As a concerned parent, how do you tell the difference between gastroesophageal reflux and gastroesophageal reflux disease in a baby? Welcome to this channel where we talk about the basic medical information making a difference. My name is Rebecca Morangi. For the returning subscribers, thank you so much. I appreciate your support. And for those who have come across this channel today, kindly consider to subscribe. Let's continue learning. Let's continue empowering each other. We said gastroesophageal reflux. This is a condition which your baby will outgrow at some point, especially when your baby gets to the first birthday. Whereas gastroesophageal reflux disease, this one will need attention where medication are needed to manage this condition. So the two need to be investigated before the tests are done. The pediatrician will ask most of the questions. The first question could be, at what age did this start? Do you breastfeed your baby or you use formula? And if you use formula, what type of formula? We have a lot of brands in the market. You will have to give the brand you're using. Another question could be, do you add anything to this formula? There are those who add thickenings to make the formula thick. How long does the feeding last? After the feeding, does your baby vomit or spit at the end of the feeding? Those are some of the questions which are being asked by the pediatrician. And also, how much do you give your baby? And this, for those who breastfeed, I think it could be different for those who give formula. Why do I say this? At different ages, or as your baby grows, the quantity of the formula we give increases. So we give formula as per the age or months of your baby. So how much do you give? Do you give too much or do you give too little? Another thing the pediatrician will ask is the family history. Why do they ask this? There are some conditions which run in families. Remember, we mentioned of what we call cystic fibrosis. This is an inherited life-threatening condition or disorder which affects the lungs and the digestive system. All this will help the pediatrician to know whether this is gastroesophageal reflux or gastroesophageal reflux disease or something else or something different. What are some of the tests which are done to make the final confirmation? When we are dealing with gastroesophageal reflux or gastroesophageal reflux disease from the previous videos, we mentioned a number of tests which are being done. I again request you to go back and check on those videos. In this case, there is no much difference in babies. There is the common one, which I believe each and every one of us have heard about it, what we call upper endoscopy. This is where a thin camera at the end of a flexible tube is inserted through the mouth and runs through the esophagus to the stomach. This test may not show when the acid is present, but endoscopy may show inflammation in the esophagus or other complications. So if the narrowing is detected during this process, it can be stretched or dilated during this procedure. We have the upper GI series. This is the moving pictures of your baby's esophagus, the stomach, and even the upper intestine by the use of X-ray. We have another test we call pH independent study. This one shows how often does the content from your baby's stomach passes through the esophagus. It can also do the pH level or the acid level of the contents. Thank you so much. If you're new here, consider to subscribe and welcome to this channel. Let's continue learning. Let's continue empowering each other because information is power. Let's meet in the next video. Bye bye.